Wellness Unveiled Candid Talk on Mental Health with Shravasti Sanyal.
Evening, Shravasti ma'am. It's truly a privilege to have you here today. I'm Dashika, and our aim is to engage in a very candid and insightful conversation with you about mental health. To set the stage, could you please introduce yourself and provide a glimpse into your professional journey as a mental health counselor?
Yeah. Okay, so I am most of the time I have y'all as my company because I am associated with an institution that caters to higher secondary education in Bombay. I am not a licensed therapist. Yeah, I am a counselor, and it's little tricky and different. So I will explain things to you as what I do. So I am a youth mentor. I mentor youth. I make them into wonderful personalities, which they already are. I just provoke them to become that. That's my job. And yes, I am a mental health counselor. Yeah, I'm a certified postgraduate mental health counselor, but I am not a clinical practitioner. Okay, so there is a little difference. I'll come to that. I'm also a life skills coach. So that's how I am, working with an institution in Mumbai, a CBSE board school. And I cater to about 500 students every day. Yeah, that's my job. And they all are in class 11 or in class 12. Yeah. And then I'll come to what I am like. I am a positive psychologist. So a positive psychologist is something which has got something to do with personality coaching. Okay, developing personalities which are very positive and grateful. So that's what I do. And how is a counselor different from that of a therapist? A counselor counsels when the person's state of mind is stable. When the person's state of mind is unstable, then she refers to a therapist. I am also a therapist, but I am not a practicing therapist. Because the world of psychology is huge. It's very big. So there are many people who does many roles. So I am in a position where I meet people at a stable state of mind. For example, I have many students whom I know who are under medication, maybe because of anxiety or depression. In such cases, under medication patients, I do not counsel. Yeah, I will ask them or refer them to go to a therapist, and then they can counsel them, because a therapy is like more like a, what do I say? It's like a project work.
Mhm.
Okay, you have a particular style of tracking the mind of the person who has come to you, and then placing the rubrics at the right place, so that the children or the people who have come to us, they organize themselves and get to a track. That's therapy. Okay, now beyond therapy, we have is called psychiatry. That is some places where you need medication. So it is all intertwined to each other. All the three of us are intertwined to each other, and we all need each other in the journey. But for my case, what I personally feel, because I am first a youth mentor and then a counselor. So what I see is that the huge prospect that is there among teenagers, because there is so many things untouched, so many places where there is a void, so many places where they want to speak to, or they want to be understood, or there needs to be a bridge between themselves and their parents. So this is a place where my role comes into picture. So that is me. I know I took a lot of time, but this is what it is.
Actually, that was amazing because as someone who wants to go into the field of psychology,
You just said earlier, like I was hearing you talk, you said psychology is so huge, it's mental health such a vast topic. So
Mhm.
talking about you, what initially led you to the field of counseling, like drew you to counseling specifically?
What a question. Right in the beginning, you've come with the bullet question. So I have a long story. I have been into brand management and marketing for about almost 2 decades. Okay. I've had a very, very difficult childhood and huge learning throughout my life. You can say the sorrow or the heaviness of not being understood at every step of life is something which I have felt very deep. And when means I am from that generation that social media, the Facebook and all the stuff started coming in into marketing. And my old-fashioned marketing style, I'm not going to break it down at this moment, just telling you the old-fashioned regular marketing style was going obsolete at that time. And it was becoming, it's weighing on me too much. So I took a back seat. I'm also a writer. I write once in a while. So I script write. So I started writing and all that, and I took a sabbatical for some time. And fortunately, what do I say? It was like an innate calling that I wanted to do something. I just wanted to do something that I'm good at. I was good at talking and influencing. I just needed the right kind of work. I just can't go on talking about selling products to people. I've had enough of that. And that's when I came across this beautiful opportunity in an institution, and they were looking for life skills coaches. So I got employed there. I started working with children. Till then, I had no clue about teenagers because I don't have a child. And my life has always been with adults. So I've not faced teenagers, and especially the present day teenagers. So it came like a big blow on me. It means the things that they are going through, the problems they are facing, it was huge, huge, and huge, and it was overwhelming me. And then when I started studying, then I did my post graduation in psychology counseling. Then I did positive psychology. I did a training on that under ICF, because these are where you're getting a full idea as to how to go about taming and training the brain of an adolescent. And that's how I became an adolescent counselor.
That is so insightful. Thank you so much, ma'am. My
Okay.
question was, what's the moment that you realized that you wanted to be in the field
Yeah,
of mental health?
yeah, I got it. I got it. So I've always had this void that I need to explain things. I shouldn't be taking things for granted, and I wanted to explain things, but it didn't happen in our times. It was even more difficult. So because we didn't have a voice. Nowadays, children still have a voice. We didn't have a voice. So that was an issue. But what happened was that when I came back and I saw the youth changing drastically. So I used to see on the road or everywhere, or whenever I'm meeting youth, I would not see, the youth didn't have a good impression on me. Something or the other that used to really make me feel very bad and upset. And I used to get upset. I said, like, youth aisa kyun hai? Why are the people like this? If this is their way, then what would happen to India when we grow old? Who's going to take care of us? Because our times we were trained in a manner that, okay, we have responsibility, we're supposed to take care of our elders and all. But later on, slowly, I started noticing that the youth is changing very much. Rather, they're not even staying in India, they're leaving their parents and going. How would the world look like? So yeah, that was the reason, mainly. And the next thing was that I get along very well with children. That's how I am very passionate about youth.
How often do you see misunderstood topics about mental health in teenagers and adults everywhere?
With misunderstood topics, give me some example.
Misunderstood like, uh, oh, kids are only depressed because of X, Y. Children can't be depressed. And another things like, how some mental disorders, their symptoms, even though they're widely available online, people keep misdiagnosing themselves with that.
That is right. A very good question that you have. Now, Dr. Google is so advanced that you don't need to go to a doctor. And this problem is there, ghar ghar ki kahani. We have it in every house. I have a doctor in my house also. So I exactly understand where you're coming from. But yeah, but I always feel that this is my way of working, that I should give my students or children a free canvas. Let them do what they want to do. Try and test, try and test. World is all about trying and testing. Zindagi, your life, everything is about trying and testing. Unless you try, test, fail, falter, you never learn and you wouldn't enjoy this journey. Would you like if I tell you, this cup is full of tea, okay, and it is sweet. And suppose your eyes are blindfolded, would you agree without sipping it and seeing whether it is sweet or sour? Or we say like, okay, Shravasti ma'am has said it and she's the best lady on earth. She's so reliable. I'm going to accept it. Imagine if I am Google. My suggestion to you all is that Google may be right or Google may be wrong, but we should always try. And misunderstanding will obviously come. Why? Because human beings are conditioned. Suppose I have lived more life than you. My mind is conditioned that I know more than you. Of course, I know more than you. I know more than you from the years or the ages that you have not walked in yet. But the ages or the moment that you're walking in now, I know nothing about because I'm not from this generation. I am zero about this. So unless and until I give the canvas to the teenagers to please explain it to me about what your world is like, I'm only going to be judging from my eyes, from my experience, from my conditioned mind, and from my perspectives. So this is absolutely a place where, the parents or the elder generation is going wrong when it comes to connecting with the youth or the younger generation. So you cannot find an answer to your question in Google, come what may. Even if you have a skin problem, even if you have something on your face or in your stomach or somewhere, you exactly don't know because your body is full of, things which are combining with each other, chemicals combining, your structure combining. So you don't know what the exact problem is, and neither does Google know. It only has to be through a doctor after a lot of examination, lot of questioning, and then a suggestion given to you after medications, trying medications to understand whether this is working or this is working, to come to a point, okay, now I know she has this problem. Even a doctor is not God. A doctor will make 10 mistakes till he or she comes to a place when she'll answer, acha, ye problem hai isko. So I personally suggest, we all go through lows, we all go through highs, yeah? We all go through numbness in our lives. You understand? Numbness. We go through the moment when we say, I have no thought in my mind. Let that moment pass. It's just a matter of moment or moments, and it will pass. One thing I'm going to give it to you all now. If you see a certain mood, a certain state of mind continuing for over 6 months in the same way, same pattern, मतलब दुखी हो तो 6 महीने से ही दुखी हो, बीच में खुशी का माहौल नहीं आया है, then you need to see a psychiatrist, not a psychologist, not a counselor. I'm going to give you a very straightforward example. A menopausing woman, okay? She goes through depression. Imagine how much permutation combination is here. She's going through depression. She's going through hell at that moment. And she's going through for months. When you go, should she go to a psychologist, a psychiatrist? Think about it, because she is aware of her body and she knows there are a lot of changes happening. So what you need is an observation skill. You have to observe yourself very carefully, very, very carefully. Is how is your pattern changing, thought pattern changing? Your thought pattern will change very subtly, but you have to observe and pack it. Ah, now I know this cannot be menopause. I am actually going through something. Why? Permutation, combination, think. Otherwise, you will note that in these 6 months, there has been times when you have toasted a drink and said, oh, wow, let's dance. Getting me? So it cannot be a psychological issue. So you need to go to a gynecologist. You will note at your teenage, your mothers are all going to be post 40s. Post 40s is not a great time for women. They are nearing menopause. Whereas you are at the peak of puberty. At this moment, अगर घर में महाभारत हो रहा है, तो it's a normal thing. That person has nothing against you. You have nothing against that person. लिख के ले लो. So whenever there's chaos in the family, especially between mothers and daughters, please don't take it to your heart. In few years' time, y'all will be best of friends. It's just a matter of time. Chachi, could I answer your question?
That was really, really awesome.
Yeah.
That actually hit home क्योंकि घर पे महाभारत हो रहा है.
हो ही रहा है. It's a normal thing. It's everyday. घर घर की कहानी. In my time, so we have had a big fight. Always hated each other. I would always say, I just want to get the hell out of this house. When will I finish my 12th? I want to go to college to a different city. I don't want to be with you. And that's every home. And I think so, hona bhi chahiye. I personally feel there should always be a trigger to think independently. Yeah. So this is also a trigger for you all to think independently, that, oh, now that I can't do without, I am just done with her or done with the family. How am I going to handle myself alone? Because I want to run away. I want to go to some city and study somewhere, but how am I going to handle alone? There comes your life skills. What kind of skills do you have? You should do a full program with me on life skills. You know, where we'll talk about this and we'll break it down and tell you how important it is.
That was really cool because I feel like that I have fights with my mom on a daily basis every single day.
I'm going to tell you something. The next time she screams, just go and give her a hug. She needs that. That's it. उससे ज्यादा कुछ नहीं चाहिए. Just go give her a tight hug. She might still be continuously screaming at you. Doesn't matter. Just give her a hug and say, okay, I'm sorry. Don't scold me. When I'll go, then you'll feel sad. Now you're scolding me, na? After some days, I'll go, then you'll feel sad. You know how to manipulate. You all are very good at it. Masters of manipulation. So tell these things to her and go hug her tight, because she really needs you. She loves you. She can't do without you. How much ever she is screaming, that is the reality.
Yeah.
And one more thing I want to say, students, that, you know, you can never please the world. किसी के लिए बाल खुला रखना गलत है, किसी के लिए स्कर्ट पहनना गलत है, किसी के लिए रात को बाहर जाना दोस्तों के साथ गलत है, किसी के लिए यू नो अर्ली मॉर्निंग उठ के पढ़ाई करना सही है. सो हर घर का एक रूल है, और as long as you're there in that rule box, you have to follow the rule, period, if you want peace of mind. Because mark my words, soon you will be leaving that house. Very soon. जब तक हो, रिश्ते बना के रखो, अच्छे रिश्ते बना के रखो, मेमोरीज सही होनी चाहिए. Because when they are gone from your lives, you should not regret, oh, I wish I had not done that to her. Because you agree, right, that y'all are just there for a few more years. For some graduation, post-graduation, marriage, whatever, naukri, you will be leaving that house and going better. You all will not be there. You agree? So for this little while, if they are telling you, do this, okay, I'll do it. It should be that way. And then things are going to be fine. Okay? Tell you something. Teen is an age where people want to be seen and acknowledged the most. They're looking for acknowledgement. They want to be seen, loved. Now, since that doesn't happen at this age, because parents are, and they majorly want it from their parents, okay? And maybe their peers also. Now, what happens is that parents are utterly busy in their 40s, very, very busy. They are in the peak of their career. Their world is changing. Maybe their parents are getting older and sicker. So they have prioritized their life in a different way at this moment. They are thinking in their mind, oh, bacha bada ho gaya. Now I don't have to worry about it. But the problem is, this is the time to worry. The minute they start thinking, abhi worry nahi karna, actually that's the time when they should actually worry. But yeah, that's coming into my parenting counseling. That's a different world. But when I'm talking to y'all, what happens is that then these students or children, they look for something which will make the people they love or want to be curious or be concerned about them. And that is when they look for a mental problem. So that helps. For example, I have so many people I've come across, students I've come across who say, I'm on pills. They're telling their friends. They're not telling me. There's kind of a flaunt that I'm on pills. I have anxiety pills. It's kind of a movie mein dikhate na aise pills le liya, wo kar liya. So they get a hype on that. They feel like, I'm liking it. And later on, this will take to vaping, smoking, drugs, and everything. Why? Because they want to be seen. They want to feel hip, important. That's what they're looking at. And they have this group of peer, jahan pe they'll have to stand out. So even that person is not a smoker, want to smoke, bol ke kisi ne bola agar, oh yes, I would want to. They don't know how to say no because they want to fit into that world. So no Google can help you, honey. It is you who has to tell yourself that how important it is to be fine here. Tell me something, I'm asking you. You ask the people who come and tell these things to you, okay? Do you want a scar here? Do you want a scar here? Huh? Do you want a pimple? Do you want anything that is not good in you? Something that is discomfort in your body? Do you want to lose a hand? Naina? And why are you looking for mental disorders? You are actually looking, अरे मेरे को पिंपल क्यों नहीं आया? एक पिंपल आना चाहिए मुझे. तब तो मैं यहाँ पे कोई दवाई लगाऊंगी, तब तो लोगों को पता चलेगा कि मुझे पिंपल है. Getting what I'm saying? That's the problem. And this problem needs to be fixed. This problem needs to be fixed at the root. That why are you going to anybody and seeking, oh, what is the problem that I'm facing? Oh, please. Every teenager on earth faces this problem. This is a very normal thing. And what about teenagers? I face. Everybody faces. Mera mood kharab hai aaj. मेरे को अच्छा नहीं लग रहा है. I'm not feeling good. Yeah, I will not speak to my friends. I'll not reply any messages. I'll shut down. I'll not go to work today. It happens. If I'm really turned off, maybe I might just do some stuff which I shouldn't be doing otherwise. That's normal human nature. It has got nothing to do with your mental problem. And I've given you the tip, keep it. 6 months of consistency of a same mental behavior is when you need to go and check yourselves immediately through a counselor, rather a psychiatrist. Is that clear? So if somebody comes to you, says, ye kab hua? Kitna din se chal raha hai? अगर ने बोला 2 दिन 4 दिन 1 महीना, अच्छा ठीक है कोई बात नहीं, और 5 महीना वेट करो उसके बाद आना. See all these breakups and patch ups and romance and likings and dislikings and sexual needs, vagera, 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 vagera. These are all pattern of growing up, and these are all the chaos that it makes. And you have to go through it. You have trod through these days. तब तो जाके कहानी बनेगी अच्छा सा. नहीं तो जिंदगी बड़ी बोरिंग होगी फिर तो, है ना? अगर ये सब नहीं हुआ तमाशा लाइफ में, तो लाइफ तो बड़ी बोरिंग हो जाएगी. तो बोरिंग लाइफ मत लो. Chill with all this nonsense. This is also part and parcel of the game.